Hello, today we'll be going over our post-operative instructions for extractions. It is very important for a patient to follow the post-op instructions because if they are not followed correctly, or maybe if their body has some kind of weird reaction to it, the patient is at risk of alveolar osteosis, which means that the blood clot is dislodged, otherwise known as a dry socket, which means that the blood clot is moved, which exposes the nerve and bone, which can be very, very painful. We will first instruct our patients to bite on the 2x2 gauze for 30 minutes. There's no rinsing or spitting for 24 hours, no smoking for 24 hours, and no drinking from a straw from 24 hours. Because you are putting extra pressure on the area and it may dislodge the clot. After the first 24 hours, you will be able to rinse with a warm saltwater rinse to promote healing. There is no alcohol for 24 hours because alcohol is a blood thinner, which can also promote bleeding. We want to instruct the patient to avoid any spicy, sharp, or crunchy food for at least 24 to 48 hours, just because they are at risk of either stabbing the site or just hurting the site. And if you eat any hot foods, the heat can promote bleeding as well. They need to avoid brushing the surgery area for 24 hours. After the 24 hours have passed, they can go ahead and brush gently. The patient will still be able to brush the other teeth per usual. They just need to be careful around the extraction site. The patient cannot be on aspirin or take any aspirin because aspirin is a blood thinner and it can promote bleeding, and the blood clot cannot form properly. If bleeding does continue, just instruct the patient to bite on a cold, damp tea bag to stop the bleeding. The patient will be able to use an ice pack after to minimize swelling. They need to put on for 20 minutes and then take it off, and then 20 minutes. So they need to alternate and not leave it on for no longer than 20 minutes on each side. Swelling is normal and can actually show up after 2 or 3 days later. The following 24 hours, a heat pad can be placed to promote the flow of blood in the area after 24 hours have passed. Because the saliva can mix with the drainage from the extraction site, it may look like there is a lot of blood, but we need to tell our patient that it's just because it's mixed and that there is not that much blood, and it will help our patient feel more easy about it. However, if they are heavily bleeding, that is not normal and they need to call the office immediately. The patient needs to continue taking their prescriptions as instructed, especially if they have an active infection or if they are at risk of having an infection. The patient should call the office immediately if they have any questions or concerns.